All right, so causes. Biology, again, there's a pretty high concordance rate in identical twins, so definitely a genetic component, but also brain trauma and brain abnormalities. For instance, lower levels of serotonin, again, that mood neurotransmitter, is often associated with severity of obsessions and compulsions. Also, things like learning and environment as well. So learning is definitely a reinforcement process. So behaviors that produce positive outcomes are more likely to be repeated in the future. So if you do something like washing your hands frequently and it makes you feel better about your obsession, then you're more likely to keep doing that behavior through positive reinforcement. Environmentally as well, though, there are social and cultural factors. In some cultures, normal cultural rituals involve elements that are seen in OCD, washing, stereotyped actions, rules, but they're not considered, problematic or abnormal in those cultures. So culture does play a role in how frequently OCD occurs and what obsessions and compulsions are more likely. So treatment-wise, antidepressants again. So antidepressants are often used to try to reduce any form of depressed mood or high anxiety is often used. So those might help alleviate some of the symptoms of obsessions, but also psychological too. CBT is a huge player. So cognitive behavioral therapy is effective, for instance, in trying to train someone to anticipate their compulsions. So being able to kind of predict when they might happen or in what environment, and engaging in a competing behavior instead. So remember, the behavioral part of CBT is all about trying to change your behavior such that it's more constructive of a behavior versus something that is maladaptive or harmful. So when you feel the desire to do a compulsion, doing something that's competing, that's going to distract you in a similar way, but that's something that's more constructive instead. So again, we're going to flip back to SciShow's Psych, and she's going to tell you about a couple misconceptions of OCD that I think are pretty interesting.